Hi, my name is Kristy Kelley, Nursing Supervisor. This skills review will be information regarding proper oral hygiene.
Hi, I am Joanne Hanson, and I'm the dental hygienist here at the Iowa Veterans Home.
And I'm Tammy Keith, and I'm the dental assistant here at the Iowa Veterans Home. We just want to let you know that we are here to serve our residents and to serve you employees, to be your backup for what you do on the units. If you ever have any questions or concerns, please do not hesitate to contact us here down in the dental clinic at 4210. We're happy to help.
Oral care is when we provide cleaning of the mouth, teeth, and gums, including brushing the teeth or dentures, flossing the teeth, and providing care for the lips and tongue. This care should be provided to the resident at least twice per day and can be provided more often. Some residents may want oral care after each meal and before bed. Some residents may require oral care every hour. The goal of oral care is to remove plaque from the teeth. Plaque develops from food and bacteria. If not removed from the teeth, plaque will develop into hard deposits called tartar. The bacteria in the tartar may lead to gum disease. Poor oral hygiene can lead to complicated medical conditions, including heart disease, stroke, diabetes, and pneumonia. Development of these situations may result in death, especially for people with weakened or compromised immune systems. At the Iowa Veterans Home, we strive to promote person-centered care. We are able to accomplish this through following the resident's individualized plan of care, which is developed by the primary nurse and care team. Following this plan of care will help you succeed in carrying out oral hygiene with the resident. Before approaching the resident, please take a moment to become familiar with the specific steps for each resident on their care plan. Following resident preferences will help you to succeed in completing the oral care. Knock on the resident's door and wait to be welcomed in. Then identify yourself. Greet your resident by name and let the resident know what you're going to be doing. If the resident is sitting in a chair, please make sure they are in the most upright position. If they are in bed, please make sure that they are positioned in the most upright manner. Remember to lock the bed wheels. Complete hand hygiene for yourself and gather your supplies. After performing hand hygiene, put on your gloves. Place a towel across the resident's chest and wet the toothbrush, applying a small pea-sized amount of toothpaste on the toothbrush. Support the resident if they are able by allowing them to brush their teeth independently. Encourage them to use small circular motions with the toothbrush. If the resident is not able to participate, you will need to use small circular motions with the toothbrush, starting at the upper teeth, outer and inner surfaces, and then the lower teeth, using small circular motions. Keep your toothbrush at a 45-degree angle to the teeth and gums. The bristles must reach down into the pocket surrounding the tooth, and then sweep from the gum line to the biting surface of the teeth. This will help remove debris from around the teeth and gums. You should already be aware if the resident is able to have water, if they require a thickened water product, or if they are nothing by mouth, NPO. If allowed, give the resident water to rinse their mouth and place the basin under their chin. Have the resident spit the water into the basin, wipe their mouth, and then remove the towel. Place soiled linen in the proper hamper. Rinse the toothbrush, rinse the basin, and place them in proper storage. Then remove your gloves, dispose of these properly, and complete hand hygiene. Residents who have their own teeth should also floss their teeth. Your assistance may be needed to help them with flossing their teeth. Wrapping the ends of the floss securely around each of your fingers. Start at the back of the teeth and place floss between the teeth, moving down the surface of the tooth, using a gentle sawing motion back and forth. Gently slip the floss in between the gum and tooth until you feel resistance. Then go back up the side of the tooth. After every couple of teeth, unwind the floss and move it so you are using a clean area of the floss. Move the floss between each tooth. After completing, offer water to rinse the mouth and assist the resident to wipe their face. Discard the floss, water, and empty basin. Rinse the basin and return it back to proper storage. Complete your hand hygiene. Return the resident to a safe and comfortable position. Make sure the call light is in reach, and complete hand hygiene before leaving the room. Observe and report any strong odor, cracking of the skin, sores or bleeding of the gums, and any discoloration. Document according to your role. Assemble your equipment. You should have denture brush, toothbrush, denture cleaner tablet, denture cup, towels, basin, glass of water, and gloves. Put on your gloves and line the sink or a basin with a towel and fill with a small amount of water. This will prevent the dentures from breaking if they happen to slip from your hands and fall in the sink. Rinse the dentures with tepid running water before you start brushing. Apply cleanser to the toothbrush. Brush all the denture surfaces and try to get in between the teeth. Rinse all surfaces of the dentures using tepid water. Again, do not use hot water. Rinse the denture cup and make sure it is clean before placing the clean dentures into the cup. Fill with tepid water so the dentures are covered. Rinse and clean your equipment and return them to proper storage. Drain the sink, wring out the towels and dispose of them in the proper hamper, then remove your gloves and complete hand hygiene. The resident may want their teeth returned to them after they are clean. Before placing the dentures back into the resident's mouth, Ensure that the mouth is free of any debris, food particles, and look for any red or sore areas along the gum line. Reapply gloves to place the resident's dentures back in their mouth. Dentures should fit well and not be moving around in the resident's mouth. If needed, denture adhesive can be applied to the denture to fix the dentures in the resident's mouth. Just a small dot will provide adequate adhesive. Gently press the dentures to the gums. If dentures do not fit well, call the dental clinic for follow-up. Dentures, when not in use by the resident, should be cleaned and stored in a denture cup with their name and tepid water covering. They should not be left in a denture cup without water. After returning resident dentures, perform final hand hygiene, report any issues with the dentures or the resident's mouth or gums to the nurse and document according to your role. A partial is a type of dental appliance similar to a denture, but only involves one or two teeth or a few teeth. Usually, a partial is anchored to other teeth, so you will want to make sure you have read the care plan thoroughly so that you know if a resident will need assistance with partial cleaning. The process for cleaning a partial is the same as cleaning dentures. Some residents may not have any teeth or dentures. They are considered to be edentulous. These residents still require oral hygiene. Use a moistened swab to clean the inside and outside of the mouth. Before performing oral care on an unconscious or non-alert resident, you will want to become very familiar with the resident's plan of care before proceeding. They will have no ability to expel anything from their mouth. If you are not certain about the care that is to be provided for an unconscious resident, please ask another peer or the nurse for assistance. You will gather your supplies: sponge swabs, towel, basin, gloves, lip moisturizer, cleaning solution, and possibly a suction toothbrush if it is prescribed. Speak to the resident and introduce yourself. Explain what you are going to do. The resident, though unconscious, may still be able to hear you speak. Unconscious residents will most always be in bed for oral care. Adjust the bed to a safe working level height for you and lock the bed wheels. Put on your gloves and turn the resident's head to the side. The head of the bed should be raised at least 30 degrees. Place a towel underneath their cheek and chin. Dip the swab in a half water, half mouthwash solution and remove any excess solution by squeezing the swab along the side of the cup. Gently wipe the teeth and gums and tongue and the inside surfaces of the mouth that you are able to safely reach. Change the swab as often as needed and repeat until the mouth is clean. Rinse with the clean swab dipped in just water, pat lips or face dry if needed, and apply lip balm. The suction toothbrush must be care planned to use for a resident. The suction toothbrush is connected to the wall or portable suction machine, and this will help remove liquids or toothpaste foam from the resident's mouth. when they are not able to swallow or expel fluids. You will apply a small amount of toothpaste to the brush and clean the surfaces of the teeth in a circular motion, starting with the upper teeth, cleaning the outer and inner surfaces of the teeth. Again, keeping the toothbrush at the 45-degree angle and using a sweeping motion at the gum line. Make sure to observe the tongue and cheeks for any redness, sores, or drainage. After oral hygiene is complete, rinse and clean supplies and return them to their proper storage areas. Dispose of any soiled linens and remove your gloves. Complete your hand hygiene. Remember to return the bed to the lowest position, making sure the resident's call light is in reach, and perform hand hygiene prior to leaving the room, making sure that you report any problems with the teeth, tongue, lips, or mouth to your charge person or supervisor. Document according to your role. As caregivers for the residents, you spend more time with them than anyone. Your observations and care directly impact the resident's status. Recognizing fruity breath on a resident could lead to a diagnosis of diabetes. Ensuring minimum bacteria in a resident's mouth through good oral hygiene decreases their risk for infection, which could lead to a pneumonia. These life-threatening illnesses can limit a resident's life expectancy. Please take the time to provide thorough oral hygiene to the residents in your care. Thank you for your attention to this skills review.